Science has given us an understanding about what happens in a brain of a person that's addicted. And by allowing us to actually find out what areas of the brain are not working and why, it provides a means to develop new interventions that hopefully can remediate some of the changes, or if not, help individuals be able to cope better so that they can stop taking drugs. For many years, people that are addicted are dismissed because of the stance that they only have poor control, and if they exerted more effort, they would be able to control the urges. What we've come to understand is, by using brain imaging technologies, is that the areas of the brain that allows us to exert self-control and make decisions and carry them through are actually disturbed by the effects of drugs. And so a person that's addicted to drugs cannot properly execute their free will. They cannot stop taking the drug even though they may consciously want to do it. Drug addiction is extraordinarily important because it afflicts a very large number of individuals, and it doesn't discriminate. And the other problem about drug addiction is it's a chronic disease of the young. So people get afflicted by addiction very early on in their late teens, early 20s. And if they don't get treated, there's a good likelihood that this will produce significant disruption throughout the rest of their life. So the relative effect of drugs into the well-being and our health is going to vary tremendously depending on the drug, depending also on your genes. Some people can smoke until they are age 100 years old and they never develop cancer, whereas many will develop cancer. So it is, again, a difference on genetics. Treatment for drug addiction works. We have to recognize that it is a chronic disease. So it works. Treatment works. What we cannot claim that it does is that it cures addiction, but it can treat it. And when you compare it to other diseases like asthma or diabetes or hypertension, the relapse rate that you see with addiction is not any different from these other chronic, classical medical illnesses.